Welcome to our show, Ask Your Doctor. For today, we have Dr. Satish G. Palayam, dental surgery from the University of Colorado School of Dental Medicine, combined his lifelong passions for medicine and computer technology and emerged as a revolutionary force in contemporary dentistry. While implementing cutting edge technology in private practice, he also travels educating thousands of dentists on integrating two exciting, fast growing technologies. Dr. Satish is one of only handful dentists in the state of Massachusetts trained on LANAP and advanced laser-assisted periodontal surgeries and LPIP and implant surgical protocol along with 3D cone beam computer tomography as well as its application in surgical dentistry with predictable outcomes. So without any further delay, let's welcome him onto our show. Hello, Dr. Satish. I hope you're doing well.
I am excellent. Absolutely excited to be here today. Thank you for this opportunity.
Yes, we are so excited to have you too. So, doctors, can you please introduce a little about yourself and what you do?
Sure. So, as you rightly said, I've been a dentist for over 28 years now. I've been practicing in the United States for over 2 decades. My initial journey starts right in Andhra Pradesh, and where I finished my high school. My dad was in the military, and from there I finished my initial dental school. I got an opportunity to come to the United States. We finished. I went into dental school here in University of Colorado. Then I did my specialty in maxillofacial surgery, and after that, I trained to integrate major technologies. One is you talked about lasers, and the other one is robotics, because robotics is a very new technology in the field of dentistry, and we are probably one of the very few surgeons in the whole globe, the whole world, where there's not many people are robotic surgeons today. And that's really the passion, bringing medicine and technology together to be able to give successful patient outcomes and great patient experience.
Yes. So, doctor, we did talk on call about how you are like one of the first dentists ever in United States to start this. But before getting into that, I was hoping you can, this is kind of like a personal question. I was hoping if you can tell, how did you get into dentistry? I mean, dentistry is something that is, quite popular, but also not many people choose it. How did you get into it? And, can you tell us the journey, please?
Yes, of course, I'll be very happy to. So both in I would say my father's and my mother's side, there was not a single doctor in the family, and then they were all engineers. And I was like, I'm done with engineering. I'm not good at math, to be honest with you, and I want to do something better. So I chose to be a doctor, a medicine doctor, a doctor. So, but as I was trying to gear up to go into medicine, my father introduced me to a couple of his colleagues who were officers in the military, in the army. And they were surgeons, and they were some dental surgeons also. And they talked about how, medicine is great, but at the same time, you should also explore dentistry because it's very fast growing into the field of, what it is today. And, and I was planning just to follow my father's footsteps to go into the army back. And for whatever reason, I guess dentistry or dental officers had a better lifestyle and better places to live, I guess. And that really intrigued me into that. But the whole thing changed when I got to know another dentist, and he really inspired me into seeing what we could do. We are not just doctors, but we also at the same time can do a lot of different things to change people's lives, people's face, people's smile. And that really intrigued me quite a bit. And that really changed my idea to go into dentistry and not into medicine.
Yes, robot dentistry. So you did give me a little slight idea when we were talking on call, but can you tell in depth about what exactly is robot dentistry and how you got into it and how now you're one of the first people ever in USA to introduce that? Can you give the viewers a little introduction about it?
Yeah, so robotics, it's surrounding our lives today, right? I mean, you go to a store, you go to a restaurant, you go, and unfortunately, if you have to get a medical procedure done, a lot of things are robotics. The goal here is about the patient, right? The outcome, better experience for patients, less complications. And robotic surgery started way back in the 80s, where they were talking about being minimally invasive. To give you a little bit of an historical perspective, NASA and the U.S. military actually started a research out of California, where if you have an army personnel who is wounded in a war zone, and the surgeon is sitting in New York, he can actually sit in New York and actually perform the surgery remotely for the patient. And likewise, NASA was also interested. What they did was they were hoping if the astronauts are up in the moon or in space and they have a medical problem, and the surgeons can sit actually on Earth and do those procedures. That was pretty fascinating. It was right out of the movies, but was it possible? Well, what happened was then, it didn't really pick up and wasn't that successful, but a very famous surgeon by the name Fred Moll, he really picked up the surgical protocol, and he became one of the first surgeons to introduce a multi-specialty robot called as a Da Vinci, which is so popular today. A lot of the medical people do it. So, but why not in dentistry, right? Dentistry has evolved today with excellent, care and super advancements. And a lot of the patients are, as you know, are very fearful going to the dentist, right? So this is what we wanted to try to explain, that, please go to the dentist. There's great things out there, a lot of great things happening. And that's when I really thought that what can we do to make things minimally invasive? Because when we do a lot of maxillofacial surgery, that can be quite traumatic. Here now with robotics, we can actually have patients come to the office, get the entire surgery done, and move or leave the office with fixed teeth in almost 2 hours. That was unheard of initially. But with this advancements in technology, it's just amazing. And I am so thrilled to be one of the first surgeons to have adopted this technology today.
Yes, doctor. So, doctor, can you tell us a little bit about what exact treatments can be done with the robot dentistry? And, maybe, for the people who want to try it, or maybe, a new dentist that who want to get into their clinics, start with robotic dentistry journey. Can you please tell us how is it very useful for the patients and also the dentists?
Great. I mean, patient, as I said, everything is patient-centered, right? The experience, the outcome. Robotics really helps in preventing any kind of complications to begin with. When we're especially working on the face and the skull and everything, we always remember the very special nerves in their blood vessels. So we have to be very careful, right? So see if I tell you that I know exactly where your nerves are, I exactly know where your blood vessels are. So it's a lot of safety. It's a lot of security behind this kind of protocols, right? So, and if you come in as a patient to my office, you'll be well assured that everything is going to go very comfortable and smooth, and you'll be out of here with minimal invasion and less post-operative discomfort, and that is the whole thing. Now, for at least for now, this robot is primarily being based out of the United States. But I know as one of the clinical advisory board members that it is going to be slowly spreading into all the other countries. India is probably being looked at as one of the options. I'm actually coming down in November to India to speak to a big group of doctors who are interested in this technology. So it's going to be an amazing conference. It's called it's in Pune actually. And there's more and more people who are getting very intrigued. And we host a lot of doctors from overseas in our offices. They can come and they can learn the technology. They can see live surgery. So it's very fascinating, and I really enjoy part of doing this procedure today.
Yes. So I personally think that after, having the conversation about the robot dentistry, I think it is going to be the new normal after maybe, 5 to 10 years. So according to you, doctor, how do you think this will help the newer generations, especially the new doctors that are coming forward, maybe in like 10, 15 years? How do you think it's going to evolve the whole dentistry in general?
Yeah, so technology is there to make our lives easier, right? And today's generation, as you know, they're very technologically savvy. I graduated 28 years ago, and I know I was having difficulty with softwares, and I remember, having flip phones, right? Flip cell phones. And today we have iPhones and all the nice capabilities. So iPhone is just not a phone today, right? It is a computer. It is you can schedule appointments on it. You can make a phone call. You can check your email, so you can text somebody. just like that, robotics is a platform, right? It's a platform where it is going to become a standard of care pretty soon. And it is actually a standard of care in a lot of the other medical procedures. Like, for example, if someone has to get a gallbladder out of there, it is becoming a standard of care, which is being done robotically. Likewise, robotics will in dentistry also become a standard of care pretty soon, like you very correctly said. And there's more and more options. So I cannot wait for the time where robotics becomes one of the mainstream for a lot of the doctors going forward.
So, doctor, we did also talk a little about the laser dentistry, and you said you've started it. Again, you were also one of the first people who introduced it in USA. And I remember you started it in 2014. So, can you tell a little bit about what exactly is laser dentistry and what kind of treatments do you do in general?
Yeah, so I mean, lasers have been in existence, I would say, since 1906. Almost over 100 years, but that science was never developed or restudied. So, but in the 80s is when we really started to get a lot of mileage out of it. So lasers are, again, very useful. It's done in ophthalmic surgeries. Eye surgeons use it a lot. Dermatologists use it a lot. General surgeons use it a lot today because, again, it's all about being minimally invasive, right? So cutting edge technology without cutting. You don't have to cut too much, right? So that's what's the emphasis here. And likewise, in dentistry, the protocols I developed was way back in the early 2000s, the mid 2000s, where patients would come in with like TMJ problems or headaches or jaw pain. The only option was to get injections into the joints or taking pills, and you're going to take that for life. So lasers actually helped us develop a protocol where you can biostimulate the muscle on the both sides. And it doesn't have to be just the jaw muscle. It could be an arm, it could be back, it could be a leg, and any of those areas there. And you start to see that it is tipping the scale from being unhealthy, painful, to being healthy and pain-free within just a few appointments. And that was miraculous. And people who had nerve damage, for example. And the biggest connection I have, for example, is my mom. She was in Singapore at the airport. She tripped, she fell, she broke her entire arm and everything, had to go through multiple surgeries. And she was numb on her little finger and her ring finger for almost 3-4 years. And I was like, just out of curiosity, I used the laser and I was able to bring almost 90% of her sensations back with the laser. So it's just very promising today. We do a lot of periodontal bone regeneration with that, which is huge. I mean, imagine we don't have to cut too much. We are generating our own bone. It works at the stem cells of your body. So it stimulates the stem cells in your body to form new bone in your mouth. And that's significant, right? And people who have diabetes, who have cancer treatment done, who have severe other infections in the mouth, they can all be treated very effectively and very efficiently. So that's what lasers do. And in my particular practice, as I said, I developed the TMJ treatment protocol, and we have treated hundreds of thousands of patients with very good success without dependence on pain medications, without any more Botox injections and things like that. And it's been very, very helpful. And there's newer cosmetic procedures are being done with lasers. So just the limit is endless, actually.
Doctor, I think from the conversation that we just had, it actually means that laser is pretty easy, and also it doesn't really have a lot of side effects. Let's say let's take a big example, that is diabetes. Somebody with diabetes are supposed to get their sugar levels or glucose levels in control, and that is when they can get with another surgery, or if they want any surgery. So are you saying that especially people with diabetes can have a lot more pros if they are getting their laser treatment done?
Yeah, in diabetics, there's two important complications if there is. One is post-operative infection and delayed healing. So if we are able to make sure that we have control over those two problems, and it's a win-win for both the patient and the doctor, right? You're able to get optimal results. And believe it or not, if you have a poor periodontal health, right, and it has been researched multiple times, you're going to have a problem on your overall health. You're going to have issues with your heart. You're going to have issues with your joints. A childbearing aged woman can have problems with childbirth and things like that. This is all due to periodontal health. So if you have a poor periodontal health, you're going to have complications. So to avoid that, to prevent all of that, imagine if we are able to use vehicles like a laser to prevent all of these complications. It is going to be a huge advantage for our patients with better results and outcomes and minimal complications,
Yes. So doctor, now that you've been in the field of dentistry for a lot of many years now, there is this slight myth that people don't really understand. Is it true that your oral care, your dental care is directly related to your everything in your body? Let's say many people get their back pains done, and some dentists say that if you have retainers on them, for a longer time, they remove it to get rid of the back pain. These are some myths. So can you tell the viewers in general about how important dental oral care is, and how is it very much related to overall body health?
That's a great question. Comes up multiple times. And one thing is for sure, your mouth is still a part of your body. It's the same highway, it's the same blood vessels, it's the same pathway for infections, and it's actually the gateway to your overall health, And we, believe it or not, we can diagnose things from the oral cavity as little indications appear on there, which patients don't even know they're suffering from. And believe it or not, we are sending so many patients to their physician saying that I feel like you may be having anemia. I feel like you may be having some form of a cancer. I feel like you may be having uncontrolled diabetes. And patients come back and say, absolutely. So if you have a poor oral health, it is going to affect your overall health. There's no questions about that. If you have a joint replacement done of any sort, if it's your knee joints or hip joints or whatever, and if you have a poor oral hygiene, you are bound to have complications for those joint replacements. If you have heart procedures done, if you have a valve replacement done, if you don't have good dental health, you're going to cause infections in those valves, So it is interesting. I actually had a patient, a good story, he has been suffering from back pain for many years. And we told him, get your periodontal health treated. You'll be absolutely fine. And guess what? Believe it or not, he stopped taking any major medications for his back. And he says, my back feels much better. So it is all the same pathway, and it's not a myth. It is a true science.
Yes. So doctor, can you tell us in general, what are some other treatments other than, the robotic dentistry and laser dentistry that you do in your clinic? I do see your clinic's name in the video. So can you tell us a little about your clinic and, what happens in your clinic? What's the everyday routine?
Yeah, so our office is a comprehensive office. We have a great team of doctors. All in all, we have close to 30 staff members. We have a full operating room setup where we do anywhere from simple local anesthetics to full general anesthesia. We treat a lot of, children and pediatric patients who have to be put under general anesthetic once to basically be treated. So it's a family practice. It's a family practice where we have doctors who can provide simple treatments like simple dental procedures to very complex full mouth reconstruction. We do facial treatments, we do cosmetic facial treatments, we do Botox injections for treating not just paralysis of the face, but also helping with the overall smile reconstruction. So we do, as I said, just simple bread butter dentistry to anything that is complex. Either it be making a person ready to go get married, or to get ready to become a model, or to a simple thing like I just want to make sure I eat my food comfortably. So anyone having problems with their teeth and also having problems without any teeth, we will be making sure that they all get treated pretty effectively.
So, doctor, now that you've been in this industry for so long, I'm pretty sure there might have been some special cases or some hard cases. There are usually people who get very intrigued. If there is something very interesting to work with, doctors often get very much interested. So, is there any special case that you want to discuss with the viewers, and maybe a story?
Yeah, so there are two important stories. So, and they both ended well. That's a good thing, right? So, I had a young girl. She maybe in her 13 or 14 years of age, and she was playing with her dog, and the dog pushed her against a counter, and she completely broke off all her front teeth, and she was like, I'm not going to go to school like this. Her mom was crying more than more than the patient was actually, and it was so emotional. So I see the patient, and she had busted off all her front teeth in the front, and her lips were all torn off and everything. We were like, give us 2 hours and see what we could do. So we did probably 3-4 root canal treatments, and we put caps, some gum surgery, we did some lip surgery, and we brought her smile back. And probably the next couple of days she was back to school, and that is very emotional. So that is one story. The other important, which I'll never forget, is a young, I would say, 2-week-old baby, and she actually was born with teeth in her mouth already. And what is interesting was obviously when you have small little babies with teeth in their mouths, it's difficult for the mom to nurse the child. So we actually decided to remove those teeth because obviously she will be getting new teeth eventually. So she was brought in. Again, her mom was crying more than the child was. And it was a good 10-minute procedure. And we pulled those teeth out just quite effectively. So that is that. But I think one of the most significant ones, I had actually an Army officer in the chair, and he was overseas at a war zone, and he was basically there was a mine blast, and he had damaged all his half of his face. So he was treated at one of the Army hospitals, and then he came in for a reconstruction with us, and we actually created a whole half of the face. And the person can take the face off anytime. It's not a face transplant. It is a fake part of the face where the patient can put the face back in when they're going out, and you cannot even tell that there's a fake face, you know? So that is all life changing for us. But one most interesting thing I'll never forget is that we got a call from the local zoo that there was a tiger that was dying of a tooth infection. And so the veterinarian called, and we said, okay, let's get it done. So we go there, and we see this beautiful, beautiful animal on the operating room table. The anesthesiologist had already put the tiger under the anesthetics, so he was sleeping. And we went in there. There was a tooth that was cracked, and there was a big abscess. So we worked in there. We got the tooth out of there, so we were able to help the tiger live. You know, so little experiences in your life.
Yes. As a doctor, you did tell about how you also teach other, maybe you go and help out a new dentist. So can you tell us how did you get into this teaching, and why did you want to help other new dentists when you are pretty much settled, doing very great with your own clinic? I think that's something not every doctor does. So can you tell that journey to the viewers watching right now?
Yes, absolutely. So I think that every doctor or every person has something to give back to the community. Right? It doesn't have to be a doctor, doesn't have to be an engineer. And it is important that the experiences that you have gained over the years, you should be able to share. You should be able to spread the knowledge. So I am actually a professor at Harvard Dental School. Harvard is very famous, as you know, as a university. And I also lecture worldwide to other younger doctors. We have a whole educational center in our office where younger doctors who want to learn advanced techniques can come to our offices and learn about different techniques in the office. So teaching has been my passion. I love to teach, and I love to share my experience and my knowledge to the other doctors, and I will not shy away from that.
That's actually very, very sweet of you. Also, doctor, can you tell us, you did tell me that you lived in Hyderabad. So you moved back to US, you moved to USA. So can you tell us why did you move, and what was the journey, and how was it? And I think I'm pretty sure it's very intimidating for people who move from one country to another. So how did you start your journey in USA?
Yeah, so like with everything. So I was having a lifestyle in India, which was, I would say, comfortable, but many, many hours of work. And I was working almost 14, 16 hours a day, 6, 7 days a week. You're young, you have the young blood, you want to go, go, go. But the problem was that, I wanted to do something more beyond that. And I was feeling like I was limiting my expertise, and I could probably learn more. So I had an opportunity to come to the United States as a part of the Rotary International Exchange Program, and that's really what helped us, get me an opportunity to get in there. My family was here. My brother has been a great support to me, in helping me learn the different tactics. So I was like, let's try this. So when I came to the United States, I haven't looked back, and it's been a wonderful journey, learning the newer techniques, going to school, teaching, and being a proud Indian, and having a great impact in the dental profession. I'm a member of some important boards in the country where usually you'd see more Americans than Indians do. So I'm very happy and proud to represent our country at that level.
And finally, doctor, anything that you want to say to the viewers watching right now?
I would say that make sure that you go to your dentist regularly for your regular checkups. Do not miss your appointments. Now, why? Because it is not just about your teeth, right? It is about your body. And the life partner is your body, and that's important for the important message. So make sure you follow the instructions from your dentist. And if you have any questions, feel free to call me, text me, email, whatever is possible. I'll be happy to advise our viewers and everyone at the station. If you need to have any questions, I'm happy to answer.
Thank you so much, Dr. Satish. It was wonderful having you. You're literally one of the sweetest person ever. Thank you again for joining onto our show. Thank you to the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.